come in and take a seat. Nice to see you again. So, I just need to check the usual details. You haven't moved since we last saw you, have you? Is your address still the same?
Yes, it's still the same, hasn't changed. I haven't moved since last Friday. I'll let you know if I'm planning to move.
Okay, good. So, you know I'm going to ask about your medication next, don't you? Any changes?
No, still the same.
Thank you.
Taking so many at the moment that I feel like I'd rattle if I jumped. Not much chance of that though at the moment. I do wish this would heal up quickly. It just seems to be going on for ages. I mean, it's only been 4 weeks, I know, but just last time I had an ulcer, it took 6 months to heal. And I really hope it's not going to take that long this time.
Okay. Thank you for this. Can I take a copy and pop it in your file?
Yes, that's fine.
Okay, lovely, thank you. Great. Right, let's have a look at your foot then. Would you like to take your shoes and socks off? I'm just going to go and wash my hands. So, how has the foot been since we last saw you? Any pain? Any discharge through the dressing? Anything you're concerned about?
You know I can't feel anything in my foot. Numb for years.
Yes, I know, but do you remember we discussed that if ever it did start to hurt, it could be the sign of a deep infection, a Charcot joint, or perhaps a broken bone. So I do have to ask you and remind you that if you do start feeling sudden pain in your feet, to let us know.
Yes, I know, but I really didn't feel anything. I didn't even notice the nail going through the shoe into my foot. It was only when I saw the blood on the carpet that I realised that I'd done it. I know I should have come in straight away, but it really didn't seem to be that serious. My wife thought it was okay as well because I hadn't been complaining about anything. It was only when she saw the blood on the bed sheets that she realised something was wrong and she brought me straight in. She gave me a hard time for giving her extra laundry to do, I can tell you.
Yes, but good thing she did bring you in. It doesn't take long for foot wounds to become really serious problems. Have you still got the hot foot line number?
Yes, I have.
So just remember, if ever you do have a concern, you can phone for an emergency appointment. But you came in. Remember, anything like that in the future, come straight in. We'd rather check and give you the treatment you need. We know that the faster we get wounds seen, the better the healing chances. The longer they're left before the first review, the longer they're going to take to heal. And the chances of infection and complications are higher.
Yes, I know. It just didn't seem very serious at the time. I hardly felt a scratch.
So, are you still taking the antibiotics?
Well, yes, I am, but they're starting to affect my tummy. I don't feel like going too far at the moment. I really hope they're not going to be taking them too much longer. Would you know how long it's going to be?
Not yet. Finish the course you've been given. I think you've still got 7 days. Is that right?
Yes, that's right.
Okay. The wound was very deep by the time you came in to see us with a local infection. We're waiting for the X-ray results to come back to check the bone is okay, but we need to watch it very closely. So, are you feeling okay in yourself? No flu-like symptoms, shivers, hot and cold flushes?
No, none of those.
Okay. Do you want to pop your feet up and we'll take a look?
Sure. Well, how's it look?
There's nothing come through the dressing, so that's a good sign.
I think I can smell something from it. Can you smell anything?
No, I can't detect anything.
I think it's really off-putting. Do you think other people can smell it?
I can't detect anything. Let's remove the dressing. Are you okay for me to do that?
Yes, fine. I wish I could tell from your face how it looks. You lot never give anything away, do you? And this is the most anxious part for me.
Yes, I do understand that. So, what have you been doing this week? You been out much?
No, not much. I haven't been able to go and play golf this week. He's told me to keep off my foot a bit. He said it's too much. I'm trying to use the shoe you gave me, but I find it feels much bigger than I'm used to. Not very attractive either, is it? Are you sure it's necessary?
Yes, it will help to offload the area and help it to heal up faster. Do you remember we spoke about keeping excessive pressure off it while keeping you active, but without doing too much?
That's not very much help, is it? I mean, how much is too much?
Well, that's a bit difficult to answer, I'm afraid, as it's not just exercise and pressure that affect wound healing. It's your diet, blood circulation, medical history, medication, and infection, just to name a few areas.
I didn't realise it was that complicated. Well, how does it look?
Well, it's 8 millimetres by 15 millimetres and 5 millimetres deep. The wound bed does look a little bit cleaner than the last time, but there are still at least 2 signs of infection, with a little area that's not looking quite as good as last week.
Oh, don't say that.
Look, we'll give it a clean and take a swab and a tissue sample and send it off to the lab. That will allow us to ensure that the antibiotics you're taking are the most appropriate ones for you.
Not more tablets.
You are still showing signs of infection in the wound, so we'll stay with the ones you're on currently until we get the new results back. But with the steroid medication you're on, we do need to be careful, as you probably won't show the classic signs of infection. So we do need to monitor the area very carefully. I'm going to double check your circulation and see if the vascular team need to see you. On the positive side, it's a bit smaller than last week, but we do need to be sure because of the medication and your medical history. Remember, we're looking for it to be 50% smaller than its original size within 4 weeks.
Just numbers.
I hope you don't mind me asking, but you're not your usual self today. Are you okay?
Oh, to be honest, not really. Ever since I had this wound, I keep thinking it's going to be like the last wound I had. That took 6 months to heal. It was a dreadful experience. I lost my independence. Couldn't drive, had to ask my wife to drive. I mean, she's got enough to do as it is. I'm supposed to rest, but it's really hard putting pressure on everybody else.
It can be very difficult trying to reduce your walking and activities, but can you perhaps modify things so you can still help? Say, could you sit down in the kitchen and help prepare the meals rather than standing? Could you help with the ironing, but do it sitting down?
Well, that's a good idea. I hadn't thought of that. It's just that since this wound happened, just everything seems to have gone wrong. I can't do the things that I used to do. I mean, everybody looks at you and they can't see that you've got a problem. It's a wound on the sole of my foot. I don't go out anymore. I don't go out on Fridays anymore. I don't go to the club anymore. I just feel really cut off. I mean, my granddaughter's getting married in the next month. I don't want to be going out to that in this shoe. It looks hideous. I worry that people can smell it. You know, I mentioned before, I'm sure it smells. You say it doesn't, but I really think it does, and that makes me feel really awkward. And then I've got all these appointments to keep up with. Every time I have an appointment, I've got to arrange somebody to take me, to drive me to the hospital. I don't know if you're going to be sending me to the vascular team with this lot. I mean, that's going to be another lot of appointments they're going to have to deal with. And it all costs money. I've either got to ask somebody to give me a lift, or I've got to get 2 buses to get to the hospital, and that all costs money, and it takes up the whole day. It's really starting to make me feel down. Look, I don't want to appear ungrateful. I know everybody's trying to help me, but it's just, sometimes it's just so hard.
Have you tried speaking to any of your friends or family about how you're feeling?
Oh, no, I don't want to talk to my wife about it. I mean, she's got enough to put up with at the moment. And I don't want to put it on the kids. They're too far away for me to talk to them sensibly. And anyway, I'm their dad. I'm the one supposed to be helping them, not the other way round.
Look, we all need help every now and again. They might appreciate being able to give back some of the support you've been giving them. You've helped them over the years. It is okay to ask for a bit of help now and again.
No, I don't want to ask the kids.
What about friends then? Is there anyone you could talk to? You mentioned Rob sometimes in your appointments. What about him?
No, it's not as easy as it seems. Well, yeah, I know what he's going to come back with. He'll just say, man up, chin up. It might never happen, and that'll be it.
But Mr. Clarkson, I do understand that it's very difficult for you to open up to people about how you're feeling, especially when you're feeling vulnerable. But it's really helpful to explain how you're feeling so we can identify how things can be improved. You've taken the first step in talking to me about this, and that's really good. The next person you talk to is usually easier. So why not give Rob a chance? He might surprise you.
Maybe.
Otherwise, there are others that can help you. Not family or friends, but health in mind. You can refer yourself to them. I'll get you the number after the end of our session, and you can think about phoning them. Some of their appointments are over the telephone, so there's no extra travelling. Or I could write to your GP and explain what we've chatted about today. Perhaps an occupational therapist would be able to help. They could identify the areas you can work on for your independence and maintaining activities without causing any problems with your foot.
Maybe. That sounds a good idea. Perhaps you could give me that number, and could you write for my GP?
Mr. Clarkson, it's totally understandable to worry about these things. Wound healing takes time and can be affected by so many different things. If your shoes are the wrong shape, it can cause pressure and friction which can keep the wound sites open. The shape of your foot may have altered from, say, 10 years ago, so you may need an insole to offload the ulcer site. And then you'd have to keep wearing it after the wound is healed to prevent it from coming back. I'm listening to your blood flow in your foot at the moment, and the signals are all sounding quite good and healthy. I can hear 2 sounds there. Just a quick question. Do you get any pains in your legs, calf or thigh area, either at night or when you're walking?
No, nothing like that. I used to be able to walk a couple of miles with no trouble at all before this started.
Okay, so taking all that into consideration, I don't think that a vascular referral will be appropriate at the moment, but NICE guidelines say that you should see the diabetes multidisciplinary foot team if you've got a new wound. Have you had that appointment through yet?
Yes, it's next Thursday before your appointment. I couldn't make the last appointment they sent me.
It's really important you attend that appointment, so if you see them on the Thursday, I'll move my appointment to Monday, so that saves you a journey. So you can see the diabetes team on Thursday, and the week after that come back to see me. That should help with the appointments a little.
Well, yes, that would help, but I thought I had to see them both.
Not usually in the same week, but if ever you're unsure, just ask. You can either ring here or appointments at the hospital, and they can help you.
Excellent, that's really helpful.
You mentioned that you were worried about the odour from your foot?
Yes, I think it smells. I hasn't been near a bath or a shower for ages. I mean, I used that device that you sent me, but I haven't washed the foot. I mean, I've used wipes and I've used a flannel, but I really don't think it's enough. I'm really worried that it smells.
I understand. These are all tools we can use to help prevent infection, so keeping the dressing on and dry will help you with this. I can't detect any odour, but if it helps your peace of mind, we could use a dressing that's designed to remove any odours. Would you like me to use one of these?
Oh, yes, that would be helpful.
Okay, I can do that.
You haven't got one that could tell if it's infected, have you?
Not yet, but there is one that's being designed to do just that. A dressing that would change colour in response to increasing bacteria in the wound. Hopefully that won't be too far away.
A dressing that would change colour if it's infected, that would really help me stop worrying.
Yes, it would be helpful, as if you notice changes in colour, you would know to contact the hot foot line straight away. But until then, we need to look out for the usual signs of infection. Redness, heat, pain, swelling, increased discharge, flu-like symptoms, shivering, or increased fluctuations in your glucose control. Now, remember, with your steroids, you may not get all of these signs and symptoms, but if you're concerned or you notice any changes, just call me.
Yes, I'll do that.
Please do. How are you feeling now? Are you feeling better for talking?
Yes, I think I do. I think I'll take on some of those advice you gave me.
That's great. So, I'm going to wash my hands and I'll get those numbers that I promised you. Would you like to get your shoes and socks back on?